or were lost to follow up because there were about 15 years between the time when they were treated for precocious puberty and the time where we found them. And we were nevertheless able to find about 200 women who returned the inclusion questionnaire and were analyzed. There are two different populations, but the full analysis set is certainly the most interesting because it's the most comprehensive, and the study has now been published. So for those of you who want to look at the details, it's fully available. If one looks at the full analysis set, these are the baseline information. Nothing special. These were patients with precocious puberty who are treated between the age of 8 and the age of 10. They were treated for about 2.5 years. So really nothing special there. They had menarche at about the age of 12. So 1 year after stopping the treatment. So nothing special. When we found them and when they were analyzed as part of the PREFER study, they were 24-year-old, so this is about 14 years after stopping treatment. So, these are many of the features of these patients. Some are really unrelated to fertility, but I think it's quite interesting to see that, for instance, in terms of academic level, they had a very good repartition of academic level, and in terms of employment, etc., etc. But one of the difficulties we had with fertility is that, of course, at least in France, at the age of 24, most women do not want to become pregnant, and the age at first pregnancy in France is 29 or 30 years. So at the age of 24, most women do not want to have children, and as you can see, 85% of the 194 did not want to become pregnant. 2% of them thought that they were unable to become pregnant. This is a questionnaire. Actually 22% had a pregnancy prior to inclusion, either wanted pregnancy or unwanted pregnancy. And you can see that there were about half and half between wanted and unexpected pregnancy, with delivery in 60% of them and 28% with abortion. The main result is actually for those who had a wanted pregnancy or with the delivery, is the waiting time to pregnancy, which is shown here on the right, whether after a wanted pregnancy they had pregnancy or not. And if you look at the full analysis